So today I'm gonna be solving few questions of ethics, and a lot of you are asking me to share my screen with you, and I cannot do that because this content doesn't belong to me. So I can't share this content with you on this platform. So if you still have any questions and you want, you can email me, and I love to share like my content with you. So let's start. So the first question is basically 82-year-old man with Alzheimer disease is brought to the physician by his daughter because of the extensive bruising on his arms. He lives in an assisted living facility. Physical examination shows large ecchymosis across both forearms and the upper arms in the varied stages of healing. His hemoglobin concentration is 11.7 and mean corpuscular volume is 78. So platelet level is basically 1,80,000. Coagulation studies are within normal limits. Which of the following is the most likely etiology of his bruising? It could be A is platelet aggregation inhibition, intravascular coagulation with fibrinolysis, increased activity of epidermal melanocytosis, and non-accidental trauma or vitamin K deficiency. So this is basically bruising on his body. So what could be the cause of it? And he has both on upper arms and the forearms, and a large ecchymosis with the platelet is basically 1,80,000, and the normal platelet is basically like 3,50,000 or something. So and hemoglobin is like 11.7, not bad, still low, and mean corpuscular is 78. So I'm going to go with vitamin K deficiency. Might be that person is not taking enough because he has Alzheimer disease. So maybe the deficiency in the diet. So the answer is non-accidental trauma. So it says the patient bruising on the upper extremity are more likely by the non-accidental trauma due to the elderly abuse. So it is basically non-accidental trauma. The elderly, especially those with the dementia, are at a increased risk of abuse. Elderly abuse is most commonly penetrating by the perpetrated by the caregivers like spouse or nursing home staff, and can be physical, psychological, and financial, and take the form of neglect. So it is basically non-accidental trauma. Why not vitamin K? Because it causes large ecchymosis as seen in this patient and deep bleeding. So this person doesn't have like hemarthrosis and hematomas, which totally makes sense. So the next question is 1 week after admission to the hospital for an extensive left middle cerebral artery stroke, a 91-year-old woman is unable to communicate, walk, or safely swallow food. She has been without nutrition for the duration of her hospitalization. So the patient's sister requests placement of the percutaneous endoscopic gastrostomy tubes for the nutrition. The patient's husband declines the intervention. There is no living will. Which of the following is the most appropriate course of action by the physician? So, what? There is no living will. And then sister requests. The patient husband declines the intervention. So, what are we going to do? 1 week of the admission with the left middle cerebral artery stroke. She is like 91 year, unable to communicate. She has been without nutrition for the duration of her hospital. Proceed with the peg placement. Consult the hospital ethic committee. Initiate total parental nutrition. Encourage a family meeting, and request a court appointment guardian, and transfer to the physician specialized in the hospice care. So I think we should like let the family talk about it, and what they can come up with the same solution. If not, then we will talk to the ethic committee. So let's see the answer. So the answer is encourage a family meeting. So first thing in this decision making, what we look for is substitute decision maker. And if there is no substitute decision maker, we will look on the family, what they are deciding, if they aren't coming on the one platform. So we'll ask them to talk, and if there is any problem, so we'll ask them to talk about it. And if still they're not agreeing, then we can move to the ethic committee. Then is the next question. 15-year-old boy is brought to the physician by his mother. His mother reports multiple instances over the past month which she walked into his room while he was masturbating. She is worried that he may be going through some sort of problem. He is currently in the ninth grade and is Mother says that he is the captain of his high school wrestling team and does reasonably well in school, and is on examination he seems embarrassed and avoid making eye contact. Physical examination shows no abnormalities. Which of the following is the most appropriate initial action by the physician? So advise a patient to stop the action, measure serum testosterone level, refer the patient for the behavior therapy, reassure the mother or prescribe sertraline, and refer the patient for the psychoanalytic. So this is basically reassure the mother. It's like a normal sexual behavior. So the answer is reassure the mother. Then comes this 32-year-old man comes to the office for a routine health maintenance examination. He admits to the recently having an affair several months ago and requests STDs. 1 week later, the results of the fourth generation HIV antibody and antigen test returned positive. The patient is counseled on the test result. The patient requests that his diagnosis not be disclosed to anyone, including his wife. The man's wife is also the physician's patient. Which of the following is the most appropriate next step? So what are we going to do? We're going to ask the patient to tell the disclose the result, but if he doesn't want to, we have to report it to the public health. So the answer here is report the infection to the national health authorities. Then comes is inform the wife immediately of the positive result, so we cannot do that. Schedule a group meeting with the patient and wife to disclose. Offer the patient repeat antibody testing to confirm results, and wait for 1 week because you disclose the result to his wife. So what are we going to do is report the infection, inform the family. What we can do is schedule a group meeting, maybe to disclose the result. Wait for 1 week because you disclose the result. Oh, okay. So I think schedule a group meeting, or we can report it to the direct health. So report the infection to direct national health authorities. We are not going to wait, or we are not going to ask for the group meeting. The first thing, the physicians are obliged to report the communicable diseases through the national notifiable disease. So if any patient who has STIs or HIV or syphilis or TB, what are we going to do? The next step, if the patient asks you to not inform it, we have to tell it to the public health authorities. So, and then what they want to do next. So the patient should be encouraged to share the results with his wife directly, but if he doesn't want to, then we still have to share it to the local health authorities so they can do something about that. Then comes the next step, is basically next question. 46-year-old woman with a history of previously well-controlled HIV infection comes to the physician for a follow-up after a health maintenance examination last week. She is currently unemployed and lives in a low-income neighborhood with her 3 children. For the past 3 years, her HIV RNA viral load was undetectable, but the last week her viral load was 8391 copies, like more than enough. So current medication include dolutegravir, tenofovir, and the emtricitabine. On questioning, he says that he misses her medication every other day. Which of the following responses by the physician is more appropriate? Let's talk about what makes it difficult for you to take the medication. I would like to check what the viruses has been resistance to your drugs. Are you aware that it's essential to take your medications every day? You should note that the skipping doses will make your HIV harder to treat. For the social worker can help subsidize next month's medication, and you should go over the instructions on how to take your medications again. So we have to find out the hurdle. So the answer would be, let's talk about what it makes difficult for you to take your medications, because the appropriate response should explore the reason, what is the problem behind it. So the answer is, let's talk about it, so we can find out the inconvenience and we can address that and help him to get over with the barrier. Next is 15-year-old girl is brought to the physician by her mother for an annual well child examination. Her mother complains that the patient has poor diet and spends most of the evening at home texting her friends instead of doing homework. He has been caught smoking cigarettes in the school bathroom and several times, and appears indifferent of the dean's threat of suspension. 2 weeks ago, the patient allowed her friends to pierce her ears and with unsterilized safety pins. So the mother appeals to the physician to lecture the patient and her behavior and set her straight. The patient appears aloof and does not make eye contact. Her grooming is poor. She's like 15-year-old girl. So upon questioning the daughter about her mood, the mother responds that she acts like a rebel. I can't wait until the puberty is over. Which of the following is the most appropriate response? What do you think of your mother's version of events? How does it make you feel? I am very concerned that your daughter is displaying some signs of depression, and I would suggest that is seen by the psychiatrist. Let's run a routine urine toxicology screen for the drugs. Would it be possible for you to step out for a few moments so I can review your daughter alone? I sympathize with you, but I'm afraid if you want to change your daughter behavior, you would have to go to peer group, and you should listen to your mother concerns, and you don't have to make a poor cloth choice early on, or else you would end up in the street. So the only option that I find appropriate is basically you have to ask the mother to leave the room so you can interview her daughter alone. So let's move on to the answer. A principal approach for caring of the teenage must take in account that the teen years are a time of transition that would totally depend to the full autonomy. So the answer is, would it be possible for you to step out for a few moments so I can interview your daughter alone? Then comes the next question. Is basically 59-year-old man comes to the physician for a follow-up examination after being diagnosed with a localized prostate cancer 3 weeks ago. The physician is delayed because of an emergency with another patient. Miscommunication between the physician and his staff created further delays. When he enters the patient room, the patient angrily expresses, do you realize that I waited 45 minutes in the waiting room despite arriving on time, but I have now waited another half an hour in this exam room? I am dying. Do you have no respect for my time? Which of the following is the most appropriate response by the physician? I am sorry for the delay. I had a very sick patient who required immediate care. I can tell you, you are angry, but this is no excuse for my delay. But you are not going to die of a prostate cancer anytime soon. So that is wrong. You have a right to be frustrated, but shouting at me is not appropriate. No. Let me apologize on behalf of my staff who's responsible for the most of the delay. I can assure you, but this will be consequences for this. I can understand your distress, but would you not blame if you choose to transfer care to another physician? I apologize for the inconvenience, but if I were you, I would be frustrated, angry as well. Let's talk about your concern. So either it is, I'm very sorry for the delay. I had a very sick patient. You required immediate care. So, or maybe apologize for the inconvenience, and if I were you, I would be frustrated. I think this is more appropriate one. So as an angry as well, let's talk about your concern. So patient is just really unhappy with the extended hours. If the situation was out of the physician control, a proper response from the physician should be simple and empathetic. So the answer is, I apologize for the inconvenience. If I were you, I would be frustrated and angry as well. Let's talk about your concern. We don't have to tell about the other person who you deal with. You just have to let that person feel empathetic and sorry about your behavior. So the next question is, 75-year-old woman is with a metastatic colon cancer comes to the physician requesting assistance in the ending in her life. She states that I just can't take it anymore. The pain is unbearable. Please help me die. Current medications includes like hydroxycodone every 12 hours. Her cancer has progressed despite chemotherapy. She is very frail. She lives alone and has no close family. Which of the following is the most appropriate initial action by the physician? Submit a referral to psychiatry, submit a referral to hospice care, consult with a local ethical committee, increase her medication dose, initiate authorization of the patient assistant suicide. So her cancer has been progressed, chemotherapy, she lives alone. So the first thing is she lives alone. That's making her more like independent. So submit a psychiatry referral, submit a referral to the hospice care, consult with a local ethical committee, increase her pain dose. So colon cancer, assistant in dying, she stated I can't take it anymore, her pain is unbearable. So I think the first thing we can do is increase her pain dose. Please help me die. So what could be the thing? Submit to a referral psychiatry, no. Yes, because the main problem for her is having pain. That's why she's requesting for the death appeal. So we have to treat the pain, maybe after treating the pain, so patient will not ask for the death. Next is 69-year-old woman with the acute myeloid leukemia comes to the physician to discuss future treatment plans. She expresses interest in learning more about experimental therapy being offered for her condition. After the physician explains the mechanism of the drug, describes the risk and the benefits, the patient then states that she is not very ready to die. When the physicians ask her what her understanding of the therapy is, she reports, I don't remember the details, but I just know I definitely want to try it because I don't want to die. Which of the following ethical principle is compromised in this physician interaction with the patient? Therapeutic privilege, patient's autonomy, decision making capacity, informative disclosure, and patient competence. So, which of the following is compromised? I think not autonomy because she is giving the will. Decision making capacity, she's like half understand and half understand, not understand. Information disclosure, so after explain the procedure and then everything, the patient, he's not ready to die. Therapeutic privilege, information disclosure, patient competence, diffusion. I think it's like more of disclosure or something. The patient appears unable to assemble. Okay, so I think it's like the patient competence and information being presented to her, and she's not able to communicate as understanding of the risk and benefit. So the answer is decision making capacity. Okay, so in the decision making capacity, it needs to be like four factors to be very clear: understanding of the process, appreciation of the process, clear reasoning through new information, and the fourth one is ability to use the information to make a choice. So first is understanding, appreciation, clear reasoning, and the fourth one is like using that information to make a clear choice. Competency is basically like, financial like grooming and living, and then he can like do all the stuff by itself. Then comes the last MCQ's 2-year-old girl is brought to the emergency department by her parents because of the painful rash of her hands and lower arms. According to the mother, she developed blisters and the redness on her arms 2 days ago. Both arms claim there is no fever, itching, or trauma. Physical examination shows erythema and multiple fluid filled blister on the arms and the hands to the elbow with the intermittent strip of the normal skin seen on the palmar aspect of the hands. The lesions are symmetrical in distribution that are sharply delineated. Which of the following most appropriate clinical action of the physician? Notify child protective services because it's like more of the burn. So it is, the answer is notify child protective services because the patient is having accidental burns like scalded, that's why the skin is peeling off. So that's about it, and then I'll definitely continue from here on. I'm gonna be covering all of this, like it's more than a lot, so we'll cover in the next session. Thank you.